Hmm.
वो ग्रुप में डाला सर।
So I have my own group also. Let me just post it there. My face is not visible as I think so. Is it visible?
वो सर।
It's kind of visible now. Okay,
Okay.
okay, perfect. It's better. Anyways, so
So start sir.
let me start. Yeah, we
One
can
minute sir.
start, I hope. Okay.
So you can start sir.
So, good evening, everyone. This is Dr. Abhijeet, Faculty of Biochemistry at Oracle. So, the Oracle has initiated a 21 days revision series live class for university exams, for the prof exams, right? So, the topic that I will be discussing up today, it is vitamins 2. Vitamin 1 I have already completed, right? So today I'm going to discuss another vitamins, right? I will be trying to cover the important questions that have been asked in the previous university exams. Yeah, okay. So yeah, I will be revising the entire topic in a very crisp, concise, and conceptual manner, right? All the important questions I will be discussing in the form of Q&A, that is the question and answer format, right? So it is beneficial for the ones who are now going to appear for the university exams and also for the ones who are going to appear for NEET PG, right? The ones who are going to appear for INI-CET and the ones who are going to appear for FMG exam. So it's like beneficial for all of them, right? So yeah, so without wasting much more time, yeah, the questions that I will be covering up today, it is firstly the vitamin C, the sources, the daily requirements, the function and deficiency manifestations of vitamin C. I will be talking about thiamine pyrophosphate, that is vitamin B1 today. Along with that, I will be focusing on the dietary fibers, the vitamin B12. I will be talking about the coenzymes of niacin, thymine, and I will be telling you out the metabolic functions of each of them, right? I will be focusing a little bit on the antivitamins, and I will be giving us such examples also that you have to remember for your exam point of view. And apart from that, the folate trap, actually, I have already like discussed in the previous video, but we'll just try to give an insight on this as well, right? So yeah, now guys, why to choose the Oracle app? You already know for flexible learning, guys, if you're not watching the classes live, you can always go on for the recorded version, which is available on the app, right? Otherwise, we are conducting the live classes daily from 6 p.m. to 10 p.m., right? For various subjects, and obviously it's live on the YouTube channel as well as on the app. Apart from that, we are conducting we already have the recorded version of the practical sessions which are available on the app, right? Before the practicals exams, you can always go on for those practicals videos which are like recorded by the expert faculty. And guys, the most important one, it is the express exam module, right? The express exam module covers everything under 20 hours, right? So everything under 20 hours, basically, we have tried to cover the most repeated, most frequently asked questions. Apart from that, whatever I feel is like more potent, which can be asked in your upcoming prof exam, they are also covered over here. And lastly, we have the hard copies book set, which you can always order from your doorstep, right? These notes are being curated in such a way to decrease the burden of those heavy textbooks. We have curated the entire notes in the form of Q and R, focusing on long essays, short essays, and type of questions. Apart from that, we have funs, riddles, MCQs, right, after each and every topic, right? So that is about this. So we have the foundational classes, right? For the flexible learning, we have the recorded version of our subject on the app. We also have the live classes that we are conducting daily from 6 p.m. to 10 p.m. And the ones who like miss the live classes can always go on for the recorded videos that are available for that particular topic on the app. We have the express exam module in which we try to cover the entire syllabus in 20 hours, right? So in this, we actually taught you know how to write the answers, right? Even we have one-to-one doubt clearing session. If you have any doubt in any of the topics, you can always go on like book a prior appointment with the faculty and you can always get your doubts clear, right? Even in the live classes there, and then in the comment section below, you can just type out your doubts and we will be happy to address it. We have the hard copy book set, which I've already told you. It's curated by the expert team, in which we have like concepts, the answer writing skills, the study plans, right? Everything is just mentioned over there. Apart from that, we have the question bank, which covers question from basic to advanced level, right? They also cover the previous year topics, the previous year 10 years topic, 12 years topic, the previous year questions. They also try to cover one-liners. Along with that, we have like curated the clinical vignettes, which are now being asked like okay, it's a hot favorite of the examiners right now, right? We have the practical session videos, which are basically like recorded and which is available on the app. So you can just go on for these practical session videos also. So we have the subscription plan, the basic foundation plan, the advanced learning plan, the complete learning plan, and the ultimate MBBS plan. You can use my code Dr. Abhijeet 20 for additional discounts, right? So moving further ahead with the very first question, write the sources, daily requirements, function, and deficiency manifestations of vitamin C. Now, guys, vitamin C, remember, guys, vitamin C, it is also called as ascorbic acid. Chemically, it is the ascorbic acid, right? So now this vitamin C, what are the various sources that you have to remember? The very first part of the question, it says the sources of vitamin C. Now, firstly, it is the citrus fruits such as, okay, let me just try to mention one of them, that is the Indian gooseberry. It contains maximum amount of vitamin C. This is again a very important MCQ that has been asked in the previous years also. So it contains the maximum content of like vitamin C, maximum content of vitamin C. Apart from that, we also have the lemons, right? The lemons. We have, yes, the oranges, all the citrus fruits, right? Even the grapefruits. These all citrus fruits, they are like containing the maximum amount of vitamin C, and among them we have the Indian gooseberry that is also called as the amla, right? So yes, we have these citrus fruits. Apart from that, we have papayas, right? We have papayas, we have strawberries, guava, pineapple, right? Mangoes. There are multiple things, right? Now, if we talk about the vegetables fall apart, in vegetables, guys, you just have to remember some of them, right? The vegetables. Now, specifically, if we talk about the red and green bell peppers, right? The Shimla mirch, right? Red and green bell peppers, they also basically contain this vitamin C. Even guys, the broccoli. Broccoli again is a very important source of vitamin C. Broccoli, right? Even spinach also, right? So these are the various like sources of vitamin C, right? So now what are the daily requirements? What is the RDA, the daily requirement of vitamin C? Let us just try to focus. Yes, we have the sources. Now coming on to the daily requirement of vitamin C. Now, guys, if we talk about adults, remember it is 90 milligram per day. it is 90 milligram per day, right? If we talk about women, it is 75 milligram per day. It is 75 milligram per day, right? Now, in pregnancy, basically the dose of vitamin C increases, right? So if we talk about any pregnant woman, guys, it is 85 milligram per day, right? It is 85 milligram per day in a pregnant woman. The symbol, it is basically for a pregnant woman, right? Now, again, in case of lactating woman, the woman who is breastfeeding her child, it automatically increases more than adults. Yes, so remember the lactating child. Okay, so not lactating child, it's a lactating woman. And remember, it is approximately 120 milligram per day, according to the standard data, right? Now, if you guys are smoking a lot and you will ask me like what should be the know the content of the vitamin C in smokers, it is not same as adults, guys. If you are smoking constantly, it automatically increase to plus 35 milligram per day, right? Basically to know actually in the smoking what is there is increased oxidative stress, and just to lower that burden we have to increase the content of vitamin C up till 35 milligrams per day. So 90 plus 35, it would be 125 milligrams per day in a smoker, right? So that is regarding the daily requirements of vitamin C. Now guys, coming on to the functions of vitamin C. Now coming on to the functions of vitamin C, just a moment. Remember, we have different functions of vitamin C. Now, the very first function of vitamin C, it is collagen synthesis. Collagen synthesis. Okay. Now you already know the collagen. Basically, we have various types of collagen: type 1, type 2, type 3, type 4 collagen, right? We have type 7 collagen also. So remember the triple helix structure of collagen. The triple helix formation. And remember, the triple helix formation is through, yes, it is through prolyl, prolyl, right? And yes, lysyl hydroxylases. And that is like very important, right? Even guys, the next function that you should remember, it helps in the iron absorption. It helps in the iron absorption. Now, when I say iron absorption, basically what does it do? It helps in the conversion of Fe plus 3 to Fe plus 2. Okay, by the help of an enzyme that is ferry reductase, and that is nothing but the vitamin C. That is nothing but the vitamin C. And this, yes, Fe plus 2 will be absorbed in the intestine. It is called as intestinal absorption. This is the one which is now getting absorbed in our body. That is the intestinal absorption. Now, apart from that, it has a cofactor function. Apart from that, it has a cofactor function. Now, when I say cofactor function, it is basically helping as it is acting as a cofactor in various metabolisms. Firstly, you should remember we have like tyrosine metabolism. Okay, one of the amino acids, right? It is not amino acid, it's the tyrosine metabolism. Okay, one amino acid that you should know, that is tryptophan metabolism. Tryptophan metabolism. Now, remember, guys, yes, in tyrosine metabolism, it acts as a cofactor with an enzyme that is PHPP hydroxylase, right? After that, in tryptophan metabolism, it acts as a cofactor in hydroxylation reactions. Hydroxylation reactions. Even guys, remember it helps in the synthesis of bile acids. It helps in the synthesis of bile acid because it is helping in the synthesis of bile acid by actually working as a cofactor with 7 alpha hydroxylase enzyme. So in this also it is basically acting as a cofactor, right, with this enzyme. Apart from that, it also acts as a cofactor in steroid hormone synthesis. Steroid hormone synthesis. Even guys, the cholesterol synthesis. Cholesterol synthesis. Right? So basically it is acting as a cofactor in the steroid hormone synthesis also and yes, the cholesterol synthesis also. Right? Now guys, remember this vitamin C also acts as a free radical. I mean, also acts as an antioxidant. And very important, it's also acts as an antioxidant. Okay. Basically, it helps, okay, it protects the cells from damage. It protects the cells from damage by neutralizing the free radicals, right? By neutralizing free radicals, right? It protects the cells from damage by neutralizing the free radicals, right? Now, if we have talked about collagen, guys, you should also remember that type 1 collagen, type 1 collagen, it is found in bone, right? Bone contains one. So remember, all the bones of our body will have type 1 collagen. Type 2 specifically, if you want to remember, it is found in cartilage. Intentionally, I have written the spelling of cartilage wrong just to initiate that all the cartilages of our body contain type 2 collagen. Type 4, basically, it is found in the basement membrane. It is found in the basement membrane. Now, when I say basement membrane, guys, you have to remember a mnemonic floor under the floor, or just like this. Okay. It is four under the floor, four under the floor. And remember that under the floor, we have basement membrane. We have basement, right? So all the basement membrane of our body will have type 4 collagen. Type 1, it is seen in all the bones of our body. Just one, you have to remember one. Bone contains one. Type 2, it is cartilage. All the cartilages. Type 3, it is found in the blood vessels of our body. So basically, these are the collagens that you have to remember, right? Intentionally, guys, you just have to remember one more part that know this vitamin C. It also accelerates, right? It also speeds up the the healing process of wounds and cuts, right? Wounds and cuts. In iron absorption, I've already told you it helps in the no improves the absorption of non-heme iron. Okay. Non-heme iron, basically it is the one which are containing Fe plus 3. Basically, it is the plant-based food. I mean, yes, it is coming, this Fe plus 3, it is coming from the plant-based foods. And especially in this, it is converting this Fe3 plus into Fe plus 2. And Fe plus 2 is the one which is getting absorbed in the intestine, right? So it is basically the plant-based food, right? So that is regarding the functions of the vitamin C. Okay, the functions of vitamin C. Now they have asked sources. We have discussed the sources. We have discussed the daily requirements. We have discussed the functions. Now we are going to discuss the deficiency manifestations of vitamin C. We have discussed the sources. Yes, the daily requirements, the functions. Now coming on to the deficiency manifestations of vitamin C. Deficiency manifestations of vitamin C. Now, the very first disorder that you have to remember, it is the scurvy. It is scurvy. Now, scurvy, basically, if there is a severe deficiency in vitamin C, if there is a severe deficiency in vitamin C, it will lead to scurvy. Now, what are the symptoms of no the patient will no come to you with? There will be fatigue, there will be weakness, right? There will be swollen and bleeding gums. Remember, bleeding gums is very, very important. There will be swollen and bleeding gums, right? Initially, it will also come up with joint pain, very, very important joint pain, right? It can have joint swelling as well. Okay. Now, again, guys, it will also have, right, poor wound healing. I already told you it helps in the accelerates the process of wound healing. So it will have poor wound healing. And guys, one more important thing, I already told you it helps in the absorption of this Fe plus 2. Now, Fe plus 2 is the central part of the hemoglobin, if you remember. If Fe plus 2 is not absorbed, obviously it will not help in the formation of these RBCs. So these patients will also suffer from anemia, right? Anemia. And remember this anemia, it is basically due to poor absorption of, right? Due to reduced iron absorption. Due to reduced iron absorption, right? Due to reduced iron absorption, right? So yes, now joint pain and swelling, basically, the blood will collect over there, and it is something which is referred to as heme arthrosis. There will be marked swelling, guys. Heme arthrosis. Apart from that, you will also get, yes, the red kind of spots on for example, on the legs, and that is something called as petechiae, right? That is something called as petechiae. Okay, so that is you guys have to remember. Apart from that, you will have, okay, I also told you that there will be no the joint pain. Okay, guys, you already know that we have something called as the costochondral junction. Now let us suppose that this is the manubrium of our body, and to this manubrium, basically what is attached? The costal cartilage. And just next to costal cartilage, what is attached? The costal ribs, right? The costal ribs. Now, in these patients specifically, if we talk about this junction that is called as the costochondral junction between the costal cartilage and the costal ribs, you will have a beaded appearance. Okay, it will be looking like the beads of a no a necklace. So basically, you will have a beaded appearance at costochondral junction. Costochondral junction, right? So that is something which is called as scorbutic rosary. Very, very important finding in the patients of no vitamin C. Although we'll be discussing it in medicine in the later classes, but yes, it is the scorbutic rosary. Now, yes, when you touch in such no infants, or in such no children, if you just try to touch that part, okay, you can obviously see those beaded rosaries from your own eyes, and if you just try to touch it, the child will burst out in pain. So remember, this scorbutic rosary, it is always tender in appearance. I mean, tender. Okay, tenderness is present, and obviously it is angulated as well. It is angulated as well, right? This is something which differentiates from rachitic rosary. Rachitic rosary is not tender and angulated; it is non-tender. So the one which is tender, it is this scorbutic rosary, right? Now there is something called as, yeah, one more disorder that I wanted to mention over here, guys. It is regarding Barlow's disease. Barlow's disease. And remember, it is also known as infantile scurvy. Infantile scurvy. Okay. So basically, at 6 to 12 months, infant, right? At 6 to 12 months, that is called as the weaning period. And it is the period when we have to give vitamin supplementation. Vitamin C supplementation is given. So it is the period when the infants require this vitamin C supplementation, right? So that was regarding the very first question. Yes, the vitamin C, the sources, right? The daily requirement, the function, and the deficiency manifestations of vitamin C. Now that was a long question, guys, so that requires much of understanding, which we have already discussed. Now coming on to the second question, guys, that is thymine pyrophosphate. No, just give me one. No. Thymine pyrophosphate. Thymine pyrophosphate. It is basically an active coenzyme of vitamin B1. And vitamin B1, it is called as thymine. Vitamin B1, it is called as thymine, right? So now let us just focus on these no vitamin B1 as well, right? Now, guys, there are various no this thymine pyrophosphate. Remember, it is a coenzyme for various no oxidative decarboxylation reaction. So remember, it is a coenzyme for. Okay, these are the ones which are very important. Pyruvate dehydrogenase, right? Pyruvate dehydrogenase, alpha ketoglutarate dehydrogenase, and branched chain keto dehydrogenase. Branched chain keto dehydrogenase, right? So basically pyruvate and alpha ketoglutarate dehydrogenase, it is basically seen in carbohydrate metabolism. Carbohydrate metabolism, right? So it acts as a multi-enzyme complex for oxidative decarboxylation. So these are basically involved in which kind of reactions? All of these three. It is the oxidative decarboxylation, where there is removal of a carbon molecule, right? It is the oxidative decarboxylation. It also helps in, okay, it acts as a coenzyme for trans-ketolase reaction. Trans-ketolase reaction, okay, in non-oxidative phase of hexose monophosphate pathway, which we have already discussed, the shunt pathway. So that is in carbohydrate metabolism. So these are all the reactions that you have to remember, guys, right, from the exam point of view, right? So that is yes. Now, if there is continuous no alcohol intake, again, one of the important part that I wanted to just yes, alcohol intake basically decreases the absorption of thymine. Absorption of thymine. Now, what are the basically the no you already have seen it. It acts as a known carbohydrate metabolism. It has a very important function. It also no has a very important role in nervous system function also, right? So yes, it helps in the transmission of nerve impulses and helps maintain the healthy nerve cells, right? So yes, if this thymine pyrophosphate, I mean, the active form is not there, right? If vitamin B1 deficiency is there, so you should remember we have two disorders related to this. Deficiency of vitamin B1 will lead to beriberi. Beriberi, basically, it can be dry also and wet also. We have wet beriberi and dry beriberi as well. Now, wet beriberi basically affects the cardiovascular system of our body. It affects the cardiovascular system of our body. So yes, we will have like peripheral edema in that case. The peripheral edema, right? The water swelling will be there, right? The swelling will be there, right? There will be high output, increased cardiac failure, increase or high output cardiac failure will be there. We will also have dyspnea, difficulty in breathing. We have cardiomegaly. We will also have pulmonary edema, right? Now, apart from that, if we talk about, yes, dry beriberi, basically it is the one which is affecting the nervous system, right? So basically there will be loss of reflex, okay? Now there will be motor neuropathy, right? There will be symmetric, both the motor and sensory neuropathy will be seen. Motor and sensory neuropathy is seen. There will be muscle cramps in the body. And in severe cases, it can lead to muscle atrophy as well, right? So yes, now these are the ones, no, which will, yes, lead to something called as Wernicke's encephalopathy. Wernicke's encephalopathy. Now, Wernicke's encephalopathy, it is basically leading to no confusion, horizontal nystagmus. There will be outward movement of this eyeball, that is something called as ptosis ophthalmoplegia. Okay, and there will be unsteady gait of the patient, right? Truncal ataxia will be there. There will be unsteady gait of the patient, right? So this can lead to Wernicke's encephalopathy, right? So yes, that is something you have to remember regarding this thymine pyrophosphate. Coming on to the next one, that is, yeah, the next question, that is the dietary fiber. The dietary fiber, guys. Now, when we talk about dietary fiber, now dietary fibers basically refers to indigestible parts of plant food that pass through the digestive system relatively intact. Now, basically, they help or they play an essential role in maintaining the digestive health and other benefits. So basically, we have different types. So remember, we have soluble fiber and we also have insoluble fiber. We have soluble fiber as well as insoluble fiber. The soluble fiber basically dissolves in water to form gel, like substance. Now, this soluble fiber basically helps in decreasing the cholesterol, decrease blood cholesterol levels, and also decrease the blood sugar levels. Coming on to the insoluble fibers, they do not dissolve in water. They do not dissolve in water and add bulk to the stool, right? Now, this is something if they're adding bulking to the stool, what they will do, they will help in preventing constipation. They help in prevent constipation, right? And promote regular bowel movements, right? So basically, what are the sources, guys, that you have to remember? What are the sources of dietary fibers? We have whole grains, right? Wheat, nuts, seeds. Okay, even the skin of fruits and vegetables, they are a richest source of these dietary fibers as well, right? If we talk about, okay, sources done, if we talk about the daily requirements, the RDA. Now, if we talk about the males, guys, it is approximately 38 grams per day. Females, basically, it is 25 grams per day. And the males who are like more than 50 years, basically the requirement is 30 grams per day. And the female more than 50 years, the requirement is 21 grams per day. Now, if we talk about children, basically it can vary with different age groups and different sex, but it may range from 40 to 30 grams per day, right? Functions we have already spoken about. So yes, if we just wanted to talk about a little bit in function also, we already know we have decreased cholesterol or decreased cholesterol levels in the blood, right? It helps in decreased blood sugar levels, helps in, okay, promotes regular bowel movements. It promotes the gut health. Now you already know the dietary fiber, it is a prebiotic. The dietary fiber, it is a prebiotic, right? So basically, it is feeding beneficial gut bacteria, which contributes to the healthy microbiome in the body. So that was regarding this dietary fibers. Next question, basically vitamin B12. Now, vitamin B12, it is also the cobalamin. The cobalamin. Remember, guys, it is a water-soluble vitamin. We have already like discussed in the previous class. Yes, we have the water-soluble vitamin as well. So it is the water-soluble vitamin, right? It is a water-soluble vitamin. And remember, it helps in the formation of red blood cells, right? So we have very serious functions. We'll come to that. Now, firstly, we should talk about the sources. Sources, if we talk about animal products, and specifically in the animal products, remember the meat of beef, right? Lamb or pork. They are the sources of this vitamin B12. We have poultry, the chicken, and the turkey. Fish, specifically the salmon, tuna, trout, right? The dairy products, such as milk, yogurt, and cheese, and also the eggs, right? So, yes. Now, vegetarians and vegans, basically the ones who are not eating these dairy products, they are at higher risk of developing this vitamin B12 deficiency, right? And it is basically the animal-based food. Now, If we talk about the RDA, the daily requirements. Now, if we talk about adults, in adults, it is basically 2.4 micrograms per day. Pregnant women, it is 2.6 micrograms per day. And automatically, if it is a lactating woman, it is 2.8 micrograms per day. Okay, so remember, if we talk about infants and children, it varies by age. Basically, it ranges from zero point 0.4 to 1.8 micrograms per day. Right. So that is the yes, the daily requirement. Now coming on to the functions of vitamin B12. The functions of vitamin B12. Now guys, what are the different functions of this vitamin B12? Let us just try to figure it out. Hmm. Now we have like two forms, active forms of vitamin B12. We have adenosyl B12 and methyl B12. Now these two are the ones, okay, where the coenzymes which are using this vitamin B12. Okay, so remember we have L-methyl malonyl coenzyme A getting converted to succinyl coenzyme A, and this reaction basically uses B12 as a coenzyme. That is the enzyme over here. It is methyl malonyl coenzyme A mutase. Okay, and yes, if there is B12 deficiency, obviously what will happen? This succinyl coenzyme A will be decreased, and what will be increased? L-methyl malonyl coenzyme A, right? So serum in the blood, basically L-methyl malonyl coenzyme A will be increased, and this is only seen in vitamin B12 deficiency. Only seen in vitamin B12 deficiency, and what is seen, guys? There will be decreased serum methyl malonyl coenzyme A, right? So yes, coming on to the next one, that is methyl B12. Methyl B12, yes, we have already discussed this methyl B12 in the previous class regarding know the folate trap and all, right? So basically it increases, if there is deficiency over here, it will increase serum homocysteine in B12 and B9 deficiency, right? So yes. Now, guys, remember that if there is methyl tetrahydrofolic acid, which converts into tetrahydrofolic acid by the help of vitamin B12. Now, if this B12 is deficient, guys, what will happen? There will be decreased tetrahydrofolic acid. Now, if this tetrahydrofolic acid is decreased, there will be impaired DNA synthesis. There will be impaired DNA synthesis, and it can lead to megaloblastic anemia. Megaloblastic anemia. Now, the proximal cause of megaloblastic anemia, it can be folic acid deficiency, even if B12 deficiency is present, right? So that is something you have to remember. Now, apart from that, it helps in the formation of red blood cells, right? We already know the other functions, red blood cell formation. Okay, so yes, it helps in no maintaining the myelin sheath. It helps in maintaining the myelin sheath, right? So that is the nervous system health, right? The myelin sheath. It helps in DNA synthesis. We have already discussed this. It helps in energy production as well, right? Promotes the metabolism of fats and carbohydrates, right? Contributing to the production of like energy, right? So yes, what are the deficiency manifestations that you have to remember? Deficiency manifestations. Remember, we have megaloblastic anemia, which we have just talked about. It can also lead to neurological symptoms. Neurological symptoms such as numbness or tingling. Numbness or tingling, right? In hands and foot. Memory loss, right? It also helps in fatigue and weakness. Right? It also helps in glossitis, right? It also helps in, no, not helps in, it basically leads to glossitis, fatigue, weakness, memory loss, right? Visual problems also, visual problems as well, right? So that is regarding this vitamin B12. Coming on to the next question, that is, yes, name the coenzymes of niacin, thymine, and give two metabolic functions of each. Okay. Now, first we'll talk about niacin, right? Let's talk about niacin first. No. What are the active forms of this niacin? Firstly, you have to remember we have NAD plus. Okay. Secondly, it is NADP plus, right? And we have NADPH. NADPH. These are the three that you have to remember. So we have, yes, NAD plus basically refers to nicotinamide, adenine dinucleotide, right? Now NADP plus basically it is nicotinamide, adenine dinucleotide phosphate, and same it is, yes, nicotinamide, right? Adenine dinucleotide phosphate hydrogenase, right? So remember NAD plus, NADP plus, and NADPH. Now NAD plus basically it acts as a cofactor. Okay, this acts as a cofactor for all dehydrogenases reaction, for all dehydrogenases except the two that you have to remember, acyl coenzymate dehydrogenase and succinate dehydrogenase. Succinate dehydrogenase. NADP plus basically acts as a cofactor. It acts as a cofactor for HMP shunt pathway. HMP shunt pathway, right? And specifically, if we talk about the oxidative phase, right? Even guys, you can remember the cytoplasmic isocitrate dehydrogenase. Right? So basically NAD plus, basically it means we are generating NADPH. NADPH generating reactions. Now NADPH basically it helps as a cofactor. for reductases, right? Example, remember we have enoyl reductase, HMG-CoA reductase, dihydrofolate reductase, dihydrofolate reductase, right? So these are the metabolic functions of this the niacin. Now coming on to the vitamin, yes, B1, that is thiamine. So we have already discussed this in the previous slide. Yes, when I have discussed thiamine pyrophosphate, please just see over here that we have already mentioned in this over here that it acts as a coenzyme for the pyruvate dehydrogenase, alpha ketoglutarate dehydrogenase, and branch chain keto dehydrogenase reactions, right? So that was regarding this question. Now coming on to the next question, the sixth one actually, the antivitamin. What is an antivitamin, guys? Now remember that antivitamin is a substance. It is basically a substance that interferes with the activity or with the utilization of vitamin in the body. Vitamin in the body, either by inhibiting its absorption, metabolism, or the activity in its coenzyme form. Now, this antivitamins basically prevent the vitamin from performing its normal function in other ways. Okay, so it can lead to potential deficiencies of that, right? So the examples, two examples, one is Evidin. Evidin basically it is an antivitamin for biotin. Antivitamin for biotin. So remember the vitamin which is inhibited, it is B7. Okay. So evidin, it is basically a protein that is now found in raw eggs. Remember, it is a protein basically found in raw eggs, egg white, right? That strongly binds to biotin. That strongly binds to biotin, right? So this binding prevents biotin from being absorbed in the intestine and leading to biotin deficiency if large amount of raw egg whites are consumed over an extended period of time. So yes, the ones who are eating eggs on a daily basis, so that can lead to no deficiency of vitamin B7. The second one that you can remember, guys, the second one for the day, yeah. Remember, it is, yes, pyrithiamine. Now again, the name suggests it is an antivitamin for thiamine. Thiamine, right? So the vitamin which is inhibited, it is vitamin B1. Now this pyrithiamine, it is a synthetic compound, guys. It is a synthetic compound that can interfere with the phosphorylation, interferes with phosphorylation of thymine to its active form, that is thymine pyrophosphate. So it acts as a competitive inhibitor for thymine, blocking its normal function in the metabolic process, right? So that is pyrithiamine. Now that was regarding antivitamin and the examples of antivitamin, right? So that was about today's session. Thank you for your patience and for listening me out. There's various social media handles that you can just follow on for the upcoming classes.